Hi, and welcome to the Skintellectual webinar on polypeptides and growth factors mix. Peptides are very popular cosmetic ingredients, and their use in dermatology is still a bit controversial because of the lack of clinical knowledge about it. For example, in Portugal, cosmetics with the 4 most popular peptides had almost 20% of share of pharmacy-dispensed cosmetics on the market in 2018, with only 4 clinical studies supporting their claims. Peptides are amino acid polymers containing 40 and more amino acids in specific sequences. Compared to proteins, peptides have shorter lengths and less molecular weight. Interest to peptides has been grown with research of cytokines and signaling factors in dermatology like growth factors. Nowadays, cosmetic experimental dermatology operates with more than 150 different types of peptides. Some terminology and definitions to clarify. In general, peptides are smaller than proteins with molecular masses of around 100 to 200 daltons, whereas proteins containing more than 100 amino acids are heavier or much heavier. There are some exceptions for such peptides, like cytokines that are smaller, and also interferons and interleukins with longer than 40 amino acid chains. Collagen and elastin are proteins. It's common for peptides to mention the number of amino acids in their chain, if it's, for example, a tripeptide or a dipeptide, etc. Sequence of amino acids defines the specific activity and characteristics of the peptides. The problem and the open question is the skin penetration for peptides and proteins. Generally, skin permeability for molecular complexes of more than 500 dalton is minimal. Molecular mass of proteins makes the skin penetration rather unlikely because the molecules are just too big. Both proteins, growth factors, and peptides are very active biological signaling factors working as an active regulator of homeostasis in key lock manner with receptors, so they fit perfectly like a key in a lock. Matrixing concept is trying to explain the peptide biological activity. So the concept of recycling breakdown fragments for triggering repair activity. The fragments of broken tissue protein, like fragments of collagen, elastin, etc., are various pieces of amino acid strings, peptides, and they can act as messengers, as signalers, sending the signals for reparation and synthesis of proteins. As a result, peptides attract and stimulate competent cells to trigger neosynthesis, for example, fibroblasts for collagen synthesis. Skin permeability is the biggest clinical and experimental challenge for peptides and proteins. Theoretically, peptides are light and they can penetrate the skin, but by structure they are hydrophilic. And because they're hydrophilic molecules, that decreases the penetration through the skin. To fight the hydrophily of peptides, palmitoyl have been added to their chain. But this can increase the molecular mass of the peptides, and of course that reduces the permeability. Growth factors are proteins with molecular masses of 500 daltons and more, and this fact makes their skin penetration problematic. Nonetheless, there is an opinion that such big molecules can still penetrate the stratum corneum through dermal gland ducts, like sebaceous glands and hair follicles, and through damaged skin, like with microtrauma, for example, microneedling, photo damage, etc. So peptides for cosmetics. Up to date, the cosmetic dermatology has more than 150 peptides studied in vitro, and this number is of course increasing. The peptides can be classified on group of signaling peptides. So that means the signaling stimulus, for example, for collagen and elastin synthesis. Carrier, transporting oligoelements needed for vitality of the cells or synthesis of proteins, and neurotransmitter inhibitor peptides, similar to the structure of the SNAP25 botulinum toxin inhibiting neurotransmitter. Growth factors, mechanism of action is explained in inflammation theory of aging, which considers skin aging as a chronic wound that doesn't heal. In theory, focus is the inflammation and immune failure to repair the skin damage. Adding the growth factor to skin treatment can modify the inflammation and increase the remodeling phase of the skin after photo damage. This mechanism is close to such clinical treatments like lasers and peelings, which stimulate the wound healing process with focusing on a controlled level of wound healing. In vitro and ex vivo studies supported the high biological activity of growth factors in reparation and inflammation response on wound healing. Skintellectual polypeptides and growth factors mix contains high concentrations of 2 polypeptides and 5 growth factors, which are 8% of palmitoyl hexapeptide 12 and palmitoyl tetrapeptide 7. So these 2 peptides. And then apart from that, 1% of insulin-like growth factor, epidermal growth factor, fibroblast growth factor, keratinocyte growth factor, and vascular endothelial growth factor. So palmitoyl hexapeptide 12 is a firming peptide for sagging skin, and it can stimulate the synthesis of collagen, palmitoyl hexapeptide 7. Downregulates pro-inflammatory cytokines and matrix metalloproteinase 1, resulting in skin firmness and elasticity increase. Both polypeptides showed collagen stimulation efficacy and reduced dermal matrix degradation in the split-phase placebo-controlled study. 28 females received the placebo cream on the half of the face and one forearm, and an other half of the face and forearm were treated by cream with 8% combination of palmitoyl hexapeptide 12 and palmitoyl tetrapeptide 7. Collagen and matrix degradation were assessed by 50 MHz ultrasound device as a subdermal low echogenic bands SLAB. Dermal fibers were assessed by confocal microscopy after 2 months of treatment with the 8% mix of polypeptides in the low echogenic space, decreased on 14.1%, and density increased on 50.1% versus placebo. Mean fiber circumference in the dermis increased by 13.2%. So such changes correlate with improved skin firmness and elasticity. Skintellectual formulation of growth factors has a focus on re-epithelialization, for example, EGF, epidermal growth factor, and KGF, keratinocyte growth factor, activation of fibroblast activities and collagen synthesis, fibroblast growth factor, insulin-like growth factor, and lastly, neoangiogenesis. So that's of course vascular endothelial growth factor and insulin-like growth factor. Now the growth factors in the skintellectual formulation demonstrate clinical efficacy in the following studies. Epidermal growth factor improves skin firmness and fine lines. Addition of epidermal growth factor to laser post-treatment protocol improves the solar pigmentation and reduces the risk of post-inflammatory hyperpigmentation. Fibroblast growth factor improves the wrinkles and skin elasticity in placebo-controlled study. And keratinocyte growth factor, the skin texture, the redness, hydration, and fine lines. Vascular endothelial growth factor and insulin-like growth factor stimulated the healing process of diabetic ulcers, of course by increasing perfusion. Skintellectual polypeptides and growth factors complex is a highly concentrated microemulsion with high-low spheres, which stimulate the synthesis of collagen, elastin, and dermal matrix. The mix has anti-inflammatory and anti-blue light in vitro effect. It improves re-epithelialization and vascularization of the skin, and it hydrates the skin. Skintellectual polypeptides and growth factors are indicated for sagging skin and wrinkles. It can be an alternative to retinol in collagen stimulation. There is an improvement of laser treatment results, and the ideal patient is younger than 30 with mild symptoms of photoaging because they're too young for retinol, because they don't want to have those side effects of some inflammation. And of course, the older patient with prevalence of intrinsic aging, like premenopause, in combination with retinol. Also, any conditions deteriorating the collagen homeostasis, like diet changes or physical activity, are ideal candidates for this mix. So that concludes our webinar for today. So thanks for watching.